Yeah, and the last bit is shorter. It's really around thinking about taking a high level view about what it is that adaptive leaders need to do as they move forward. And Heifetz says, that this is really where the rubber hits the road. And when we think about this in terms of integrated care and the care, there's this series of issues about which staff should be connected to which programs, how teams communicate with patients and families, how do we develop programs that deliver the results that we need with the resources that we have. Heifetz summarizes all this work as an improvisational art. There is no recipe. Everything in leading adaptive change is an experiment. And he says if these are issues that are really critical to the organization, sometimes you have to phrase them or pose them as solutions rather than tests of change, but with mid-course corrections likely. I think he's a little negative around this because I think we've reached a point now in the current environment where the skills around quality improvement have given us an opportunity to actually use the science of improvement and implementation science to make a difference moving forward. And so, yes, it's still uncertain which things are going to be successful and what PDSA cycles are going to really improve current performance. But we know how to do that. We know how to evaluate that, and we know how to work in an effective way moving forward. So two comments that I have here. First from Paul Batalden. Paul Batalden is a pediatrician who was one of the architects of the Institute for Healthcare Improvement, and he and Don Berwick and others put this together in the mid to late 1980s in an environment where nobody thought that quality improvement would apply to healthcare because healthcare dealt with so many different specific problems. You couldn't deal with this as a larger scale issue. And what they did was essentially create an organization which has changed the way in which healthcare is designed and delivered in many, many countries around the world, including Canada, obviously. And I would add to that the work that's going on now at the next slide in the Center for Implementation and this recent program that they've released called Map to Adapt, understanding that there's a defined process for evaluating existing elements that you want to add. So if you're designing a new program, a new set of activities, looking for things that have already dealt with this issue, then asking the question, to what extent does this meet our needs? Is this a good fit? How do we adapt this to make it a better fit? How do we implement those adaptations? And then how do we evaluate, reflect, and revisit what we're doing moving forward? And this work now available on their website, cited here, but also a number of programs that are doing this as well. So the tools for taking these ideas that start out as big, bold statements and turning them into well-defined programs are increasingly available, and I think should be used and then shared as we see what people are doing in different environments, and we go back to this idea about where do we need to really focus to ensure that this program is standardized, and where do we need to focus to make sure that it's adaptive for the patients, clients, families, and environments in which we're providing this care.